Well, it is 6:35, so I'm going to kick off this meeting. Thank you to everyone who's here so far. I expect lots of stragglers to come in the next few minutes. My name is Terry Martin, and I am on the ORD2 Indivisible Steering Committee. This is part of a series we started a couple of months ago as we're talking about policing and dealing with some of these social issues in the Rogue Valley. And so we decided that part 3 here would be looking at the Cahoots model, which happens in Eugene. It's been up there for about 30 years. And we do have a representative of Cahoots with us tonight, as well as 3 other members from the community that are working on trying to bring something like that here and have some experience in that way. I'd like to briefly introduce them, and then I'm going to go around and let them introduce themselves. First, there's Tim Black, who is with the Cahoots program. Second is Misha Blair. She's with NAMI Southern Oregon. And then, you want to wave, Misha? There you go. All right, Shelby Henry, who is with Community Works, who works with survivors of domestic violence. And Sarah Westover, who is a Phoenix City Council person and is also involved with the Real Solutions Coalition that has been working around the clock to try to bring something like this to Jackson County. So welcome all of you. And I'll let Tim, you talk a little bit about yourself first and give us an idea about Cahoots.
Thanks, Terry. So yeah, my name's Tim Black. I am the Director of Consulting for Whitebird Clinic. That's a relatively new job title for me, though. For the last 10 years, I've worked as part of the Cahoots team. Starting in 2010, I started working as a crisis worker for the program as part of that 2-person response team taking dispatch calls out in the field. And then in 2016, I started to transition into more of the administrative side of things, where for the last few years I've focused on all aspects of operations of the Cahoots program as the operations coordinator. That work, on budgets, on contracts, on really everything that goes into the day-to-day operations of the Cahoots program has also lent itself well to my role representing Whitebird Clinic and the Cahoots program with other cities across the US and up into Canada as various communities look at implementing the Cahoots model. Just so that we're all on the same page here, a very brief overview of the Cahoots program. Cahoots is one department of Whitebird Clinic, which is a federally qualified health center serving Lane County. Cahoots is an acronym that stands for Crisis Assistance Helping Out on the Streets. And we're a 24/7 mobile crisis response program that utilizes and is dispatched by the public safety communications system. That means that everybody that's in crisis and is calling to request Cahoots services is accessing that non-emergency police and fire line. All of those calls that come through the non-emergency line, as well as 911, are triaged by the same call takers that are handling all of the police calls, all the fire calls. And then from there, those calls are sent to Cahoots teams that are actively out in the field responding to dispatch calls. We use a police radio to receive all of our calls for service. And every time you see that Cahoots team out in the field in Eugene and Springfield working with somebody, you're going to notice it's a team of 2 folks. Like I mentioned, we have a crisis worker, but then the other member of our 2-person staff team for our responses is an EMT. And that combination of the crisis worker and the EMT allows us to really respond to a wide variety of situations that range from non-emergency medical care, chronic wounds, first aid, all the way through behavioral health crises, ranging from general, counseling for just having a rough day to mediation between roommates or family, working with folks who are unhoused to get connected to resources, as well as responding for, relatively high acuity, high priority situations that have to deal with suicidal ideation or substance use and abuse, other, pretty significant concerns. And through that dispatch response in the public safety system, and our partnerships with not just the police and fire departments, but also various community partners, Cahoots is responding to almost 24,000 calls per year. That makes up almost 1 in 5 of the calls that come through our non-emergency system, and is really significant to me because this entire program that we're talking about costs around $2 to $2.5 million a year to operate, and we're saving just the hospital system $8.5 million a year. When you start to look at the cost savings and diversions from law enforcement, from keeping somebody out of that criminal legal system where they're cited and released, and then they miss a court date because they don't have anybody to wake them up with that alarm clock or help them get to that court date. There's this whole cycle that gets perpetuated when folks encounter law enforcement for these quality of life issues for whom, that mobile crisis, that behavioral health first response would be the more appropriate resource to send. Cahoots is very successful in our community and is something that is built for the Eugene Springfield area, but there's a lot of lessons learned from the 31 years that we've been doing this that I think, really present a significant opportunity to Jackson County to really build something incredible and nuanced to the needs of your area, rather than having something handed down to you by some group in Salem. So I'm really excited for this opportunity to engage with you all. And let me tell you, it's a relief to be talking to folks in Oregon again after spending a lot of time remotely out on the East Coast. So I'm just super excited, and I thank you all for taking time out of your evening to talk about something this important.
Thanks, Tim. Misha, let's move to you, and let's talk a little bit about, you're with NAMI, but tell us a little bit about what happens now when people call with certain types of health crises in Jackson County.
Okay. Well, my name is Misha Blair, and I'm with NAMI. NAMI stands for the National Alliance on Mental Illness. For any of you who don't know, we're a grassroots organization with the goal of improving the lives of anyone affected by mental health conditions. So we do get a lot of calls from people when they have problems with the system or problems trying to find help, and or even just anecdotes of I've had someone call me who said their neighbor was psychotic and delusional and was threatening them, and they didn't want to call the police because they knew she was sick. So, but what could they do? And it's hard to get those calls because there really isn't a lot of options around here. So if the person isn't willing to go to the hospital, the emergency room, then basically you have to call the police. So that's what that's why NAMI's involved. We really want to have some kind of option that fills that gap between the emergency room and jail. Personally, I'm in this work because my son is incarcerated. He's in prison up in Eastern Oregon, and I really want to get something like this in place so that when he comes home, there's another option if and when his mental illness relapses. I have some place to call that keeps him from just ending up back in the system. So that's kind of my own personal perspective on that. And NAMI got really involved in this during the jail ballot question. And so that's how I learned about Cahoots, was we started really investigating what are the other options besides jailing someone. So Sarah actually introduced me to Cahoots. I'm super grateful for that. So that's it.
Okay. Shelby, why don't you tell us a little bit from your perspective about what happens, how does Community Works fit into this piece of the puzzle?
So we are a nonprofit in the Valley that responds to domestic violence and sexual assault survivors. We provide resources to them. A lot of the clients that I work with are dealing with mental illness and drug addiction, and on the other hand, their abusers are frequently in and out of jail and prison, and it's just this never-ending cycle because they're not getting the help that they need to treat and prevent it from continuing. So I'm in court on a daily basis, and I'm listening to arraignments and a number of things, and it's the same people with the same charges, and it's just really disappointing. So I was a call taker for Central Lane 911 and taking those calls that were being funneled to Cahoots to respond to. And it was one of the greatest experiences I've gotten to be a part of. And the overwhelming support and cooperation from the community, it was really neat to see that in the community and see how effective it was, and kind of wanting to find a way to bring a part of that or all of that eventually here. It might take us 30 years, but we'll put along.
Yeah. Do you try to avoid people calling the police or because there isn't anything in between? I mean, what kind of dance do you have to do to try to help your people?
It's hard. I think when we know that mental illness is a component, I would love for them to not call law enforcement. And this is hard for me because I have a badge that gets me into the Medford Police Department, and that's where I work out of every day. There's a domestic violence task force, so I'm working really closely with an officer who takes me out to people's homes to let me do follow-up for people that we can't reach over the phone. So I'm working really closely with them, and but these are not mental health professionals. These are not people who, and I don't want to, it's a fine line. They want to catch the bad guys. And if the bad guys are drug users, they just want to put them in jail and go that law enforcement route because that's how they've been trained, and that's just how their brain is working. And I don't see the benefit there. I feel like if drug addiction or bipolar disorder or schizophrenia or whatever is going on, that needs to be treated medically. And that it's never going to be fixed in the law enforcement realm. I really don't think that a cage and handcuffs and weapons are how we fix that. And so ideally, no, they don't call 911. They call a non-emergency, non-law enforcement agency that can kind of come in, and they do have that mental health background, and they are able to meet them where they're at, whether it's crisis counseling or suicide prevention, suicide intervention. One of the toughest moments ever at Central Lane was a suicide that she had repetitively called, and she thought people had put a listening device in her ear, and phone calls increased, and we kept sending Cahoots to her, and law enforcement kept kind of getting intertwined, and eventually she ended up killing herself. And that was rough. And that is essentially what kind of had me reach out to NAMI. And so just trying to, we have suicides all the time here in Medford and the surrounding area. And I think that's a lot of where my passion is. And just trying to figure out a route to make it a little bit easier and not have them handcuffed and put away, because they don't really ever get out of that system. I think it's really, really rare to have somebody fully recover from being in that system.
Seems to complicate it more than it does to help.
Mm-hmm.
Is the line here in Jackson County that the police don't come unless the person is threatening to hurt themselves or someone else, or will they come sooner?
It's typically once a threat has been made, once they are saying, especially if a weapon is involved. But yeah, it is typically once a threat is made to either harm themselves or somebody else, law enforcement is coming out. I'm listening to the dispatch radio, but I don't have it on all the time. It's just kind of when I'm there at headquarters. And I think every single day law enforcement is involved in some kind of suicidal ideation call or threat or something to that extent, and or a drug addiction related call. Somebody who is unhoused and in some kind of crisis and doing something that is not within the social norm, and so law enforcement is called to either remove them or but it's not actually treating them. So
okay, all right, Sarah, I want to bring you into this. Tell us about your work with the coalition, which I will say that I've sat in on as often as I could, and I'm really enjoying, but I'll let her explain it.
Thanks, Terry. Sarah Westover here, she, her, hers. I am working with the Real Solutions Coalition. I'm also a city councilor here in Phoenix and a volunteer with the Rogue Action Center. As Misha was saying, I started getting involved in this work when, about a year and a half ago now, the Jackson County Sheriff started coming around to all of the city councils in the Valley really trying to pitch this idea of building a new 900-bed jail that would cost over $1 billion over 20 years. And as he was trying to go through this proposal and tell all these cities, you know, we really need this new jail, we were asking questions like, well, what are the off-ramps here? What could we be doing more of that we aren't doing right now? What are the gaps that people are falling through in terms of, you know, keeping people out of jail in the first place? There's got to be more services that we can provide to help make sure that we keep people out of jail. Like Shelby was talking about, it is really a traumatic event to be in jail or in prison. It keeps people from working. People can lose custody of their kids. They can lose their jobs. They can lose their health care. It certainly doesn't help, even though we have banned the box in Oregon, if you are looking for a place to live, exacerbates all sorts of problems. And it's proven to show that people who go to jails are more likely to recidivate and commit more crimes and end up in jail again in the future. So a lot of us really didn't think this jail proposal made any sense. And there was a lot of pushback that we got from the county when we started asking questions about, well, what are the services that exist now and how can we do things differently? And there are a lot of incredible services that our county provides, but there are some things we don't have. We don't have a mobile crisis intervention team. We don't have a 24/7 crisis center. We don't need those things automatically to start building towards a Cahoots type project, but we did start engaging with the county and having those conversations about what's missing and what could we be doing better. So ultimately, as most of you know, we did end up defeating the jail ballot measure this past spring, but that proposal is not done. The county will bring it back, and they may not bring it back on the ballot. They may just try to pass it through their own means. So this is something, having a conversation about Cahoots right now, and this is kind of what the Real Solutions Coalition is doing together, is having a conversation about what are the real solutions? How can we stop, reduce incarceration, reduce recidivism, and the need for these, like the most extreme measures. When we first started having these conversations, we had a great presentation from Tim, came down, virtually, and did a presentation that included, there was a number of law enforcement officials there. There were county officials, including from Jackson County Mental Health. There were a number of elected officials. And I gotta tell you, there is a lot of interest. It perked up a lot of ears, even from people like the Medford Chief of Police was like, oh, I wanna learn more about this. I wanna hear more about this. So there are things that we can do here locally to push for a Cahoots-esque initiative. And hopefully, I'll leave it at that for now, but hopefully we can talk more about, if you want to get involved with those efforts, how we can push locally to move some of those things forward. Because, and one last thing is that Cahoots, their mobile crisis intervention team is mostly funded from the cities and county. So they do have Whitebird Clinic, which Tim, I'm sure we'll talk about, which is does receive federal funding, but the bulk of their funding for the mobile crisis intervention team comes from cities. We can absolutely do that here. And we just need to start having the conversation with our local elected officials, put it on their radar, and start building that interest and political will. So we're going to be talking more as a coalition about doing lobby days, about going to council meetings. So we'll talk more about that.
Thank you, Sarah. Tim, I know that you guys are you've got, how many employees do you have now? I know it's 24/7, but you've been at this for 30 years. I'm sure you didn't start at that level, right?
No, absolutely not. When we started the Cahoots program, you go back, our first shift was on July 4th in 1989. When we started, it was just 40 hours a week. We tried to do evening hours and make sure that we covered the weekend, but it wasn't even something that was available 7 days a week. We started with a real small staff team. When I joined the Cahoots program in 2010, there were 13 folks on the team. And for the first time ever, we had more than 12 hours a day of coverage. So it's really only been the last few years that the Cahoots program has grown to the level it has, even within our own community here in Eugene and Springfield. So, it can be really easy to get attached to that, after 31 years, this is where Cahoots is at, and that's what we want tomorrow. But it took us a long time to build that capacity, right? To be able to build a program that could respond at that level. And so, there's just so much potential in your area in the Valley to really look at how does this work with multiple smaller communities, each lending some resources, to ultimately develop a response that's going to be meeting the needs of so many different folks throughout your entire county.
How many employees do you have now, and like how many vans?
We have up to 3 vans on the road, depending on the time of day, and it takes about 40 staff for us to cover just the field operations. We have another 6 FTE that goes into our administrative functions outside of that too. So it's, when you include trainees and a couple of part-time volunteers, there's 50 humans that are working on this Cahoots thing at this level, day in and day out.
Oh, thanks. If anyone has questions, please put them in the chat box, or if any of the other panelists want to chime in and ask specific questions, whatever, please feel free to do so. And how big is your budget now, Tim?
So the total operating cost of the Cahoots program, including some indirect expenses that we don't see, but that are managed by the cities and the county, full operation cost for the Cahoots program comes out to about $2.5 million a year. And we're responding to almost 24,000 calls for service on that $2.5 million.
And does that service include the intake itself? I mean, you go to your mobile crisis team, you go and you find the person, then what happens if you need to get them off the street? Does Whitebird Clinic provide that space, or do you have to work with city and county facilities?
Yeah, so we have to work with a lot of community partners to really be successful on any response, not just the housing calls. Whitebird Clinic, which is our parent organization, is a federally qualified health center. So within Whitebird Clinic, we have access to behavioral health treatment on an outpatient basis. Same goes for substance abuse treatment. We have a medical and a dental clinic. We have more traditional counseling resources. And then we have case management and systems navigation that includes benefits assistance. So there's a lot that we're able to accomplish just within the umbrella of Whitebird. But when it comes to things like shelter, we really are looking to our community partners. The Congregate Shelter in our community is a privately run organization that would be perceived as higher barrier to many folks in the community. And so we've had to look to other groups like community supported shelters to find ways outside of those traditional congregate shelter settings to address the housing need. Eugene has the highest incidence of homelessness per capita in the US. Depending on how you slice it, between 5,000 and 9,000 folks are considered unhoused or housing insecure on a nightly basis in our community. And for us to say that we've got it covered with the one congregate shelter that can hold in non-pandemic times 500 beds, we've got a lot of work to do. And so that's where it really resonates with me and what's going on in your area down in the Valley. With all these smaller communities, there's just so much potential to really think outside the box. And like I said, rather than take the guidance from Salem on what to do next, really create something that is by and for the folks of Jackson County.
Now, I've heard some concern from, I think it was somebody in the county law enforcement, I can't remember which, but was saying that they didn't think Cahoots worked down here because we're such a large community. We're a large county. You guys only deal with Eugene and Springfield, and you can get a crisis action team anywhere in that area in a really short time. But with Jackson County, I mean, we just cover more square miles. Any thoughts on that from you or from any of the panelists?
I mean, geography is certainly going to be a challenge. It's not as simple as it is here to hop on the Beltline and in 10 minutes I'm in Springfield and I'm at the call. But that issue of response times in large areas is something that's coming up in major metropolitan areas too. So if a big city can figure it out, I think that your county can come up with something too. But yeah, I would like to hear from some of the other panelists too around where geography fits into the planning for this type of program.
Anybody else on the panel?
Sarah, you want to take that?
Sure. I mean, I think that, there's a lot of logistical things we would need to figure out to make a mobile crisis intervention team work in Southern Oregon. I do think, so there's, one is the question of proximity, right? And how will we get people in? I think to a large extent that would depend on who we find to be an organization to house such a project, right? So there's been some ideas that have kicked around. Right now we have Jackson County Mental Health, which kind of does a lot. They do the Current Crisis Center. They do a lot of projects. Of course, they're always, have a lot going on or underfunded. We have the CCOs, which do, administer different, healthcare providers. We have, there's just been a whole slew of names that have been tossed out there as potential hosts of this project. So maybe Access or La Clinica. At this point, we don't know those details yet. We're not that far along in the process. But I do think that, what the discussion has been with the coalition so far is that making it a regional project is really the way to go. I saw the question in the chat about, well, in Ashland, they said there wasn't enough work for a mental health care provider. One, I doubt that's actually true, and I would love to see the data on that. But, we're talking about a totally different system that doesn't exist in the Rogue Valley yet. So we would be comparing apples to oranges anyway. I think that if all of the cities come together and chip in a little bit towards a budget, as Tim said, it's really not that much. It's, well, I mean, it's in terms of municipal budgets, it's not that much. The $2 million that Tim is talking about, for example, for 1 year in Medford, the annual police budget is $30 million. So when you talk about $2 million for a project that's diverting hundreds and hundreds of calls away from the police and away from ambulance services, it really pays off. In terms of the physical pieces and the logistics, I think that's going to come much further down the road. I think right now the conversation is, figuring out who could house such a project, who's the, appropriate organization, but also just getting buy-in from the cities to start looking at this and to start developing that interest and to start thinking about, that's something we contribute funding to. And then I think some of the nuts and bolts pieces will come later on.
I agree with that. And I also, I think that Tim has helped other people of varying sizes get things figured out. I think, Tim, you mentioned something about helping one coastal area. They're so small that they are using volunteer firemen as the EMTs, if I remember rightly.
Yeah.
So, I mean, we've got this wide range that Tim has actual experience with, and I think can help us get that together. And I also can't help but wonder about some of these criticisms of something we haven't even tried yet, and they're conflicting. So, oh, we don't have enough work, or, oh, it's too big, we have too much work. Well, let's figure it out and see what happens. Sometimes you just got to try something before you can see what the problems are going to shake out to be. Tim?
Absolutely. Yeah, and even, in Denver, where there's a pilot program called the STAR program, that's their Cahoots equivalent. Even with that program in Denver, rather than have one organization, they chose to go with a coalition, right? So the crisis workers are coming from different organizations. Depending on the day of the week or what shift it is, you might get somebody from Servicios de la Raza or, the Mental Health Authority. And then their firefighters, their EMTs are all coming from the fire department. So even in a bigger metropolitan area, we're seeing how a more collaborative approach is creating a program that is much more responsive, right? It's much more nuanced, and there's a lot more opportunity for interdisciplinary training, where if your providers from one organization have a lot of experience working with folks who are undocumented, that experience is going to translate. And then there's this teach back that happens between, the group that's working with, maybe migrant workers, and then a group whose emphasis is more on harm reduction. And so then all of a sudden you start to develop multilingual harm reduction resources, So I think that there's just, again, I can't say it enough. There's just so much opportunity to really look at this as a collaborative effort. This doesn't need to be something that's facilitated by a monolithic nonprofit or even one of your CCOs. And on that topic of there's not enough work to do to justify a 40-hour-a-week presence in Ashland, something that your CCOs are going to be really interested to really engage with you on is the idea that a mobile crisis response isn't just there for strictly mental health calls, but there's an opportunity to address all manner of social determinants of health. And every single CCO is looking for that social determinants of health kickback. If they can show to Medicaid that they are working in their community to address poverty, to address underlying mistrust of community institutions, to address access to resources like transportation. If they can hit all of those metrics and say, look, we did these things in our community, then Medicaid says, hey, here you go, here's your kickback for social determinants of health. So, you know, it's not just mental health. A crisis emerges when there is an unmet need. And if we can work, if this mobile crisis program is empowered in your community to address those underlying needs, then, you know, really the sky's the limit and where a program can go and where the funding can come from to really support it.
And aren't there going to be a lot more calls anyway? Because if you have someone in your household, and we talk about this being on the streets, but I mean, a lot of people are dealing with mental health crises in their families, with friends, their neighbors, and the last thing they want to do is call the police, and they don't know who to call, really. I'll say I've been in this personal experience with a friend. I didn't know who to call. I called NAMI, and I tried to call, you know, it was on the Sunday and nobody was in Jackson County Mental Health, and you know, the police said, is that person trying to hurt themselves? And it's like, you're just so panicked. You don't want to deal with the police. The last thing you want to see is the car pull up and take away your person that you love so much in the back with handcuffs on. So I'm assuming that when they say there's not enough work, that could also be that because people may not want to make that call for a safe and compassionate response. But yeah.
And it was a worker that was along with police. So you see, there's a difference there between what Cahoots does, where they send out non-police. It was still a police presence. So I think that would cause me to hesitate if there was something crisis related going on where there could be some concern about someone being shot. I mean, that's a real concern. We've seen it happen. So if I could call a number for a Cahoots and know that somebody without a gun is going to show up, I think that would be a big difference.
I think it would too. And I think that 40 hours a week would be filled up a lot faster than we think. Tim, what errors have you made along the way? What problems did you have that you had to learn from that you could pass on that advice to us? And what went surprisingly smooth?
Definitely. I think honestly, the thing that was the most surprising to us in the rollout was how welcoming, you know, traditional public safety infrastructure was to this new thing. When Cahoots started, you know, Whitebird Clinic was a young organization, you know, and we were perceived as being very counterculture. The name Cahoots is even a tongue-in-cheek reference to the fact that the hippies were in cahoots with the cops. And for me today, the meaning of Cahoots has changed to be more about where we are in the community and our ability to really meet folks where they're at and be in cahoots with the patients that we're serving. So, you know, I was, you know, I think we were all surprised with how readily, you know, accepted we were. And that speaks to a lot of what Shelby mentioned earlier around many officers aren't signing up to be police because they want to do mental health work or because they're really interested in social services. You know, folks are signing up to be police because they want to go chase the bad guy, right? They want to go, you know, dust for fingerprints after that window gets smashed. You know, there's a specific motivation that goes with joining the police department, and generally those aren't consistent with what you see in folks who are attracted to mental health work. So, you know, we really need to make sure that we're putting the right people in front of these crises, you know, that we're putting the right folks in the driver's seat for these responses. I think that the biggest misstep that we had, and something that we're really trying to address now in 2020, is how you access Cahoots. For the entire 30 years that we've been that we've been offering this service in our community, we've been asking folks to call the police non-emergency line. You know, granted, when you call that line, you know, you get sent to a phone tree and you have the option of police, fire, Cahoots, but it's still the police number that we're asking folks to call. And so for 31 years, we have been asking people on some level to call the police on themselves when they're in crisis. And we're relying on call takers like Shelby was to really make sure that they're triaging those calls appropriately and that they're getting Cahoots to the calls that Cahoots needs to be at. And so right now, today, we are working with our police departments on standing up a dispatch that's specific to Cahoots, to have a number that you call that's answered Cahoots. rather than trying to get through that phone tree. We have no idea how many folks we've scared away because when they call the number that they thought was Cahoots, they get that EPD, auto response, and you have to navigate. I got to press one. How many times do I have to press one to get through to the call taker? So I think that's something that, as not just, Medford or Ashland, but every city looks at this model is that point of access is going to become really important. And if there are ways to decrease barriers to accessing that service by having a number that's not connected to police, I think that you're going to see really tremendous results. If you have a number that folks can call that are not English speakers, and if there's a way for non-English, response to be folded into your system, you're going to be reaching so many more folks than we are even here in Eugene and Springfield. And again, that's because of how folks are asked to engage with us right now.
Shelby, do you have thoughts on that?
Yes, so many. I definitely have experience with, the regulars who are working with Cahoots on a daily, weekly, monthly basis. They're comfortable calling the line, and they know what to say, they know what not to say, and it's not confusing to them. But for somebody who's calling for the first time, we pick up, Central Lane, they're confused, and it's having to kind of explain the process to them. And they see the Cahoots number and they have no idea that they're calling a law enforcement agency. And on the other end, when I'm picking up the phone, if I am trained that if there's any mention of a weapon, basically the Eugene Police Department isn't going to allow Cahoots to just respond. They're going to go out, they're going to make sure everybody's safe first. They're going to either, remove the weapon or it's going to escalate because law enforcement is there. And the other component is we're not always telling them, okay, well, I just heard you say he's got a knife in his hand or there's a gun in the house. They might not even be holding the gun, but when there's a mention of there's a gun in the house, that will trigger a law enforcement response. And, when you're not, and a lot of times we're not telling the caller that because we don't want them to panic. We don't want it to escalate before law enforcement gets there. And so they're opening the door and it's a police officer, and that's not at all what they wanted. And it's not always what they should get. I think that things escalate really quickly when that happens. So yes, when you call the Cahoots number, you are getting people who are trained by the Eugene Police Department and those protocols and those responses. And I think it would be fantastic if there was a training that was just from Cahoots and there was a safe number that somebody could call and know that law enforcement wasn't involved and that their phone call wasn't being recorded and could potentially be used against them. And, they have to say the right thing or they're going to get a police officer. And I think just in my experience there, and I was there for, just under a year, and this probably didn't happen right away, and I'm sure Tim can attest to that, but, when we get a call that there's a homeless man who's, drunk in a parking lot causing a scene, or there's a woman running around, all of these calls, law enforcement doesn't want to go out to that. They love to be able to push that onto Cahoots. And I don't mean that in like I'm sure that didn't come across well, but they really like having Cahoots to be able to say like, oh, can you put Cahoots on that call? Or, so that they can go out to the bank robbery and those calls that are what they want to go out to. They don't want to deal with the unhoused. They don't want to deal with, somebody with a needle in their arm. There's so many things that law enforcement doesn't want to deal with. And I think there's definitely some pushback here in this area. And it's a bummer because I wish they would just, I wish we could just get our foot in the door to where, the Medford Police Department and Ashland and Talent and Central Point and all of these smaller areas can realize that this is going to help them. This is going to make their jobs a lot easier and, allow these people to have a mental health professional with them that is going to give them better services. Community Works has a shelter, but the barrier to that is you have to be in a domestic violence situation. So if you don't say the right things and you are not in a domestic violence situation, you don't get into our shelter. So there's other shelter options, but you can't use ours. We've got advocates at DHS Child Welfare. We've got advocates at the Self-Sufficiency DHS office. We've got advocates at Rogue Medical, and all of these other advocates that are stationed kind of throughout Medford. And that's really helpful to get into services that are outside of our own. And I feel like if we could create something that is similar, where you've got people working in all of these different venues to kind of create this larger solution, that's what's going to cause change.
Okay, so someone asked whether domestic violence would be part of this equation or not. And I guess what we're talking about here is pretty much mental health, right? And all the factors that go around this. But I also see poverty as being part of it, houselessness being part of it, substance abuse being part of it. So domestic abuse or domestic violence situations are often tied into that, aren't they?
Yeah, I think a big component of domestic violence is, at least I deal with mostly women. I would say 95% of my clients are females that have experienced trauma, that experience depression, anxiety, low self-esteem, eating disorders, this number of things, drug addiction, poverty, and all these barriers that keep them staying with their abuser. And it's not easy to leave. And I think trying to, and my first suggestion is usually counseling, and trying to set them up with healthcare and find a counselor that is within the network and accepting new patients, because working on yourself, I think, is the surest way to get to a better and safer situation. And I think that mental health is such a huge component. And so, yeah, I think domestic violence and mental health really go hand in hand. And 100% of my clients have something that is a mental illness component.
Neurons that fire together wire together, right? And so with a mobile crisis response, when it comes to those intimate partner and family violence, situations, they might not be the first unit that shows up on scene. There are a lot of different reasons, and that's a whole other panel to talk about. But there is still a trauma that's occurring there, and if trauma, and if there's an intervention, really soon after that trauma, there's a lot of potential to really impact for the better, somebody's neurobiology. And one place that Cahoots fits into that landscape of those IPFV responses in our community is as that connection to after an incident has occurred, after an aggressor has potentially been arrested or is no longer on scene. Cahoots serves as a conduit to get an individual connected to other supportive resources. So there's that empathetic ear, right? That ability to process that trauma right in the moment, but then also discrete, free transportation that can help get to an independent third-party location that's going to be safe for everybody involved, to get connected with that caseworker and those advocates from an organization in our community like Women's Space or like Shelby's organization in your neck of the woods. So, while they might not be responding without officers, I think there certainly is, a lot of different places where mobile crisis response is going to be able to support and augment services like Shelby's.
Misha, did you want to add to that? You're muted.
Gotcha. I had a question about kind of going back a little bit to the non-911 number. I can already hear the criticism about that with safety issues, because we already get that anyway. So how have you and law enforcement work together to figure out how to make sure that those calls that will come to this new number are being correctly, divvied out to the right person? Somebody might want Cahoots to answer, but maybe that isn't the best person for safety reasons. How are you guys going about that?
So what we're looking at doing is really formalizing Cahoots as the third branch of public safety in our community, which would mean that there's Cahoots, police, and then fire and EMS. Right now, police and fire and EMS have their own consoles. Whoever's working the Station 2 at Eugene Police Dispatch is also going to be responsible for the Cahoots units. And so that means that right now that dispatcher is responsible for 12 patrol units, plus a couple of Cahoots vans, depending on the time of day. And that's just too much of a workload. So what we're looking at is having 3 dispatch consoles. So it's still the same building. They're still, sitting in cubicles next to each other, but there's a separate phone number, just like there is for the fire department, for Cahoots. And that call is going to go to a call taker whose sole responsibility is to receive the calls for Cahoots and then dispatch the team. So we're still going to be looking at using public safety resources for that call taker and dispatcher, but we're going to be our own standalone entity. So there's not that, as Shelby can really attest to, discretion of the call taker about what resource they're going to send when you have multiple units and it available, and it's kind of ambiguous. So looking maybe outside of Eugene, though, in Texas, we have an example in the Harris Center where their dispatch for Harris County, which is Houston, Austin metro area, has crisis workers embedded. So that call comes into that call comes into the dispatch center, and it's a behavioral health crisis. There's an attempt to route that to a phone-based intervention within the dispatch center. And then after that, if there's not resolution and a safety contract that comes from that, and they do need somebody to go out in person, that person who received the crisis call is able to send the request to dispatch for a unit to go out. And, at that point they are sending officers out. But I think that, with that example and looking at the geography of the Rogue Valley, that might be an option too, is to look at, could you have that upstream diversion resource of a crisis worker maybe embedded in your call center that can be trying to address these calls before sending out that in-person response. And then from there, it's really up to you to look at, how do those things work in concert? Is that something that's needed, or do you want to just focus exclusively on this mobile response first?
I also just wanted to clarify, the Cahoots van and everybody working, they have a radio. So over at dispatch, we can hear, their communication. And so I shouldn't say frequently, it was, it's happened multiple times where Cahoots gets out to a scene and they're like, we need law enforcement. And so they have a radio right there. They call for backup of, law enforcement backup. And we are there. I mean, it's a quick response. So I felt like Cahoots, their judgment was always really great. And so they knew going into it whether they've had prior interaction with those people in the past, or they just could kind of read the room. And they knew that if they weren't safe, they had somebody to call that was going to be there in, a minute or less to respond however is needed if something is escalating and out of their scope.
Yeah, it's when we allow othering to really permeate our discussions about this kind of response, it gets very easy to turn to these are dangerous people or those are dangerous people. What we experience is that by and large, folks who do act out physically, who are aggressive with Cahoots response, are generally intoxicated, or alcohol is the primary factor behind the situation that emerged and for which Cahoots is responding. So, generally it's our experience that it's only when folks get drunk that we really have the bigger issues. Every time that I got punched on Cahoots, which is a very small number, I think half a dozen times in 10 years, every single one of those people were folks who were intoxicated and for whom I wasn't giving my full attention, especially when it came to scene safety. So, it's just our experience that this is not as dangerous as the general public perceives it to be. Shelby mentioned we do have to call for police cover sometimes, but last year we only had 150 situations where we had to call for code 3, that's lights and sirens cover. 150 out of 24,000 responses. That's less than 1% of the overall call volume, escalating to a point where we need officers to come and pull us apart from each other. About a third of our calls overall do involve police or fire, but generally those are calls where police and fire showed up first and then are able to hand the call over to Cahoots, rather than us going on scene and then saying this is outside of our scope and handing it back over to those traditional resources.
I see a lot of discussion in the chat about the budgets of cities and whether it would include the county. I think it would definitely need to include the county. I'll just say that clearly, because you've got I think it's 65,000. I guess it's like a third of the people live in Jackson County, something like that, live in the unincorporated areas. So we, cities are going to have to fund their part, but then the county's also going to have to fund its part as well. In terms of the other budgets, if anybody's been following in the chat and wants to fill me in on anything that was important that came out of the budget from Ashland or from Medford, you can certainly chime in and let me know. Sarah, if you've been watching it.
Yeah, I'll weigh in a little bit on the funding piece. So again, circling back to, how would we get something like this funded? It makes a lot of sense for both the cities. The major cities would have to be on board, right? So that would be like Ashland and Medford, make the most sense to get a commitment from them. That being said, in Ashland, I know Julie Akins is in favor of looking at, proposal and how do we do this, and have been communicating with her. But I do think we have to put a lot of pressure on these city councils. And, trust me, as an elected official, it means a lot when a dozen people show up or, 50 people show up. And I want to give an example. When we were working on the jail proposal, which was proposed by Jackson County and the commissioners, when the county circled back around to it, the county commission, we had about 50 people show up and give testimony at the county commission meeting. And one of the county commissioners ended up voting down their own proposal because so many people came out and said, this is a waste of money. We want you to invest in alternative programs, in services, in things that are restorative. So it does make a big difference. But these cities aren't going to do it on their own. The county isn't going to do it on their own. They need community members to push for this, and they need to hear a constant and consistent message. And when we're going to these meetings, we don't need to have all the details yet. We have some fantastic people who are working on a written proposal. They're on this call. Leslie and Misty are working on that. And that's awesome. That's fantastic. But we don't need to have all of the answers, and we can't expect, if the county tries to put that back on us, then we just have to say, this is something we're building for the long term, but we need you to know that we want this, and we want you to work towards building towards this in our community. Think about $2 million and what that would look like split across the county, cities like Medford and Ashland. Obviously, there's a lot of support in the smaller cities, like Talent has a lot of support. They've been really active in this coalition. In Phoenix, we have, which is arguably the most conservative city council in the Rogue Valley, we have a draft social equity resolution on the table right now that's got support from most of the council and is likely to pass on August 17th that says we want to pursue funding support for a Cahoots-like model. Other cities can do that too. If the most conservative city council in the Rogue Valley can do it, Ashland can do it. Come on. So yeah, I think $2 million split across the county, across Ashland, across Medford, it's really not that heavy a lift. And I know that some people are asking this question, well, does it inherently need to come out of the police budget? And the answer is no. I mean, it could. That could be one way that we propose it, is say, well, what if we took $500,000 out of the larger police budgets, whether it's Ashland or Medford, who have very sizable police budgets. But there's other sources of funding too. There's community development block grants. There's municipal sources of funding that could be ongoing for these projects. And right now, that's where we are, is let's get a commitment from the cities to be interested in this and to start, talking about it. Maybe having another meeting where the county and the cities and the social services agencies get together. I think it would be great if we'd hired potentially a consultant. And Tim, I don't know if that's work that you do. Do you consult for a fee, or how does that work?
Yeah, well, I'm the director of consulting. We do need to, try to cover expenses, but we would absolutely be in a position to be able to support the work that's going on. And it's likely that I would be the one doing that with you all because we have these relationships now.
I think it should also be noted that, go ahead.
Oh, I was just going to close by saying, so that would be a great ask for our city councils. And right now the coalition is in a place where we're writing up some talking points and preparing for a couple of days where folks go to your city councils, write public comments. Let's get out there and make sure that they know this is a priority. And I'm going to take a second and drop into the chat. I'm going to drop a link to a form that you can fill out if you're interested in going to city council meetings, if you want to get email notifications about how you can be involved in the fight to bring a mobile crisis intervention team here. Go ahead and fill out this volunteer interest form, and that way we can call you when stuff comes up and get you plugged in and helping out on the fight.
Awesome. I'd also point out that Senator Wyden also has an act right now. It's a Cahoots Act. Is that what it's being called right now, to possibly bring federal funding into communities to support this? Tim, do you know about the status on that right now?
Yeah, so the Cahoots Act was introduced last week. We were just as surprised as probably anybody else to read the paper when we discovered that. Senator Wyden's office had mentioned that they were looking at this as part of the larger George Floyd Justice and Policing Act 2020 bill. But what Senator Wyden introduced last week is a bill that, if approved, would provide a pool of $25 million that would go to communities to fund 95% of the mobile crisis operations for a 3-year pilot phase. That would allow communities to really have an opportunity to build a program and then provide it with the opportunity and at the time to really become successful before cities were, responsible for covering the entire cost of that program. So, it's really up in the air as to whether or not that's going to pass right now. Anybody who has family that lives in another state, please encourage them to reach out to their state senators to advocate for this bill. But if it doesn't pass this time, who knows? Maybe by early January, we might see a different organization in DC that would be able to pass this bill. If that does become available, that's going to just open the doors up in a huge way for cities everywhere. Not just in the Rogue Valley, but that is something to keep an eye on. And to that extent, looking at Medicaid as a potential funder, don't shy away from really engaging with your CCOs in your area. And additionally, for those city councilors and those county commissioners, maybe remind them that Senator Wyden has described Cahoots as the Oregon model, and that there's some very awesome potential here to be a part of that narrative.
And we've learned in Indivisible to make sure you call your senators even though you agree with them, and know that, so they know you have your support as well. So Absolutely. On the daily calls that you're making, call Senator Wyden and thank him for adding this to the policing bill, because he needs to hear from you, for sure. So specific next steps we need to take. I mean, we've talked a little bit about that, but I mean, are there certain things that we need to do next to bring something like this to Jackson County?
Well, Terry, if it would be helpful, I could share a list that Real Solutions has put together, the 14 kind of things that we think are really important to be included in the Rogue Valley model. I think that would be helpful for people to have, because I think one of the first things that we can do is to, like we're doing tonight, educate ourselves so that when somebody says, well, what is Cahoots, or what do we mean when we say we want Cahoots, we can explain exactly, those points that we want. And if we go to our city councilors, or we write them, or we email them, we can say, look, these are the things that we think are important. Do you mind if I share my screen real quickly?
Go right ahead. I had that list up earlier today.
Okay, so some of these overlap a little bit, but it's some of the things that we've learned from Tim, and then some things that we've added in for ourselves. And I think if somebody has these ideas in mind, basically, that it's a regional mobile response, that we're having partnerships within the communities so that we can really wrap around people and really support them and lift them up in whatever means they need, and that we include input. I think that was maybe one of the big errors the county made in their jail proposals. They didn't really go out and ask people what they wanted, and they just kind of kept it within their own group. And I think having input is something that we're learning from the Black Lives Matter movement. Like, we need to do that. And so we've got that included. and hopefully staffing would reflect that as well. In that it's non-police, that it's about medical and behavioral. You know, we keep talking about behavioral health being a medical condition. So we need to start treating it like a medical condition. You know, we don't call the police when we break our arm. You know, like we need to have the appropriate response to what the situation is. And we talked about 911 and alternative phone number. So that's both. That question came up in the chat at one point. So it would be both, so that you wouldn't have to remember if you didn't have it on your fridge. You could also still get a hold of them. And regardless of insurance status, that's something that will come up at some point. Somebody will ask. And even though we think the CCOs would be good to include them, we also want to make sure that we cover folks that don't have insurance. And then the training, we didn't really talk about that yet. But Tim's team has over 400 hours of field training in de-escalation and harm reduction. And I can't remember the phrase that you used, Tim, but being aware of your situation so that you can predict the safety issues. And that's compared to our current crisis intervention team training that our police get now, which is 40 hours. So that's a one-time 40 hours, and then they're CIT trained. So that gives you an idea of what the difference is. And we'd like to have some accountability, public oversight of that, so that we can keep transparency, which would also be helped with being operated by a nonprofit, and then start where we can and expand from there, and then share data. So that's kind of some of the things that we're looking at. There's not a lot of data right now. I think that's a big hole we have. It doesn't seem very sexy or interesting, but it's hard to make decisions when you don't have data. And so we're just trying to even get from the police, like, a percentage. How many of your calls that you answer in a shift would you like to have a crisis center to take that person to instead of jail or the ER? Just, ballpark it for us. But we want hard data, of course, but we haven't even got a ballpark right now. So, getting that data as we start out, I think will really help us to continue to evaluate and tweak and support. So I hope that helps.
That's great. I'm going to back up to the part about the insurance. Are people charged when Cahoots shows up? Tim?
No, absolutely not. Cahoots is a free, voluntary, and confidential service. Many of the folks that we're working with are, members of, multiple marginalized communities. And if we're restricting our services to those who can affirmatively answer when we ask them for their first, last, date of birth, social security number, and insurance, we're not going to be serving anybody. Additionally, when you're under a bridge at 4 a.m. and it's raining sideways, I don't care if you want to go buy Bugs Bunny for the next 3 hours. If I can get you somewhere safe and keep you warm and alive for the night, get you a full belly, then we've done far more than we would be able to accomplish if I argued with you for an hour and a half about how I need to have your exact spelling for your last name.
Okay, so where does the insurance come in, or the Medicare, when they actually?
The area that our CCOs and Medicaid come in to support is through wraparound funding. So that's not a fee for service, but what we're looking at there is because Cahoots is available, because Whitebird Clinic resources are available to members covered by the CCOs in Lane County, there is a kickback that those CCOs are getting by addressing social determinants of health. And so because we are helping them accomplish those metrics, we're helping them hit those numbers, we receive a certain payment per member per month. And what that does is that goes to supplement the services that we're offering. It allows us to be able to train our staff with better quality resources. We're able to offer more resources and more tools for CEUs. And we're also able to then translate those wraparound services funding into more responsive basic needs provisions. So food that somebody can actually chew without teeth, becomes remarkable when all you're given is peanut brittle and crackers from the food kitchen, and you haven't had dentures in years. What are you going to do with that? So the Medicaid programs are really there with that wraparound funding to make sure that we can really adequately respond to the needs of the entire community. And honestly, half of our ER savings, that about $4.5 million a year, is direct cost savings to the CCOs. So even though we're not billing them, even if they're not getting the bill for the ambulance ride, there's still a financial obligation if that person does go to the emergency room. And so there's an intrinsic interest that they have to really make sure that there are adequate resources to keep folks out of those emergency resources.
There's a question in the chat that says, is there a write-up of the Medicaid incentive for the CCOs to get involved?
We could, if folks are curious to learn more about how we got to that place, I would be happy to engage with those folks outside of this panel. And you can just reach out to me at tim@whitebirdclinic.org. And I'll throw that in the chat too.
That is someone from the Real Solutions Coalition too. So I'm sure that would represent that group. The final question I have, and I know we're getting down to the nitty gritty here, but is that what actions and steps can each of us take to go forward in this? Will each of you give us your ideas on what we should do at this point? Start with Shelby.
Voting. I think being knowledgeable and knowing who we're putting into these positions of power, it becomes, if we voted in these people who really don't care about mental health and they don't care about the prevention and the treatment, and they are more so going to fund the law enforcement route, it's going to be much harder to put these things in place. I think asking questions, asking the right people those questions. So when we have people running, when we have even judges, spending so much time in a courtroom lately with this job, I can tell a difference in the judges who really don't want to see you go to jail, and they want to see you in a treatment facility. They are asking those questions to make sure that you're not going to come back. So I think being really picky about who we have in positions of power. I have seen firsthand that when you have the wrong people in power, you really don't get a voice, and you don't get to, if you think something is wrong, or if you want to see change and your moral compass or values differ from the people who actually have the power, you don't get anywhere. So that would be my biggest thing, is I think being mindful of who's in those positions. Yeah.
Important. Thanks. How about you, Sarah?
Yeah, I think Shelby raises a really important point, is the people who make decisions about these kind of programs live here locally. There's a number of your elected officials that are on the call tonight. And we do have an election coming up. In fact, the Real Solutions Coalition is organizing a candidate forum that is coming up on October 3rd, I think is the date we landed on, right, Karen? I see nods, so that's good. Okay. And we're going to ask questions about criminal justice reform and about mental health solutions. And that's an awesome opportunity we'll share with you all to learn who's out there in the candidate field who is going to work on the issues that you care about, and that create more holistic approaches to solving problems in our communities. So definitely encourage that. Right now, I dropped a volunteer interest form, or an interest form, in the chat. Please fill that out. If you're interested in this work at all, just make sure we have your contact information, so that I think the plan is probably within the next month here, start really organizing to go to city council meetings, start trying to gain support. The first step in anything is making sure that those who have decision-making power are educated on the issue. Right. And so far, I think there's still a lot of gaps. So there's some baseline knowledge about Cahoots maybe, and there's certainly more interest gathering, but we need to show up in numbers too large to ignore so that people go, oh, wow, you know, people in our community really want to see alternatives that work. So if you fill out that form, we'll keep you posted about lobby days that we'll be organizing. We'll send out talking points and get folks riled up and coming out for this. I also think a good next step is, you know, we need to get back together with the county and elected officials and hopefully hire a consultant, you know, like Tim. It'd be great to work with you more on this. So that would be one of the first steps, and maybe one of our first asks for when we go to these city council meetings is say, look, the first step in any of this, if you're interested, is let's hire somebody to help us create a plan, which cities do literally for everything. Like if we hire people to make a plan for the things that are way less cool than this. So it happens all the time. Cities spend tens of thousands of dollars on consultants, and we should definitely do it. So there's a lot of opportunities for engagement. So make sure that we have your contact information, and we'll start sending out more information.
Perfect. Misha, what can you add to that?
On our Facebook page, I put it in chat. You can go ahead and get to that candidate forum questionnaire. Like if there's some questions you'd like to see posed to those candidates, you can have a chance to put some input in there. Also, I think for Cahoots specifically, we could use stories. So as we've seen in the past, personal stories are extremely effective. If you've ever had a situation where you think Cahoots would have really helped you or your family or a loved one, you know, think about contacting us. We can just do it in writing anonymously, or we could videotape it. This would really give us a chance to show that what we're talking about is real people here. We're not just talking about $2.5 million. We're talking about real people that are daily needing help. So I'm always kind of a big advocate for stories. That would be helpful.
Awesome. And if they wanted to submit those stories to you privately, is there a link through your Facebook page?
I can put my email on there, but you could also just let them know if you filled out that volunteer form for Real Solutions that's what you wanted to do, and you wanted to do it anonymously. We would totally keep that anonymous. But I'll put my email also.
Okay. When you mentioned a Facebook page, is that under the Real Solutions Coalition? Is that what it's called? Or
it's actually my NAMI So Facebook page that I was referring to. I'm not sure what's on the Real Solutions page right now, but I made sure that the NAMI So Facebook page had that candidate forum questionnaire. So I put that in the chat also.
All righty. And then the candidate forum will be publicized how?
It will be we'll put it on NAMI's Facebook, but Real Solutions will also put it out, and we'll make sure there's a press release. And we might even take out an ad in the paper just to make sure everybody sees it. So keep your eyes peeled. And then, like Sarah said, the volunteers on the email list will definitely get that too. Anything I missed, Sarah?
I'll just add real quick, the Real Solutions Coalition doesn't have a Facebook page, but the Rogue Action Center will be sharing a lot of this information through our website, and just make sure to drop your email in that form so we can get a hold of you. Thanks,
Okay.
Misha.
We will leave these links on the chat here even after the meeting closes, for those of you who need to copy and paste or write down on a napkin or whatever it is, however you want to keep that information. And then ORD2 Indivisible will also help in terms of, we'll try to post what we have in our next newsletter so that those of you who need that information and lose it for some reason can find it again. We will probably hopefully have a link to the recording of this meeting. We are recording it now. This will probably have it up, hopefully, and it's up to Hillary and my tech team. But at this point, have it up so that people who weren't here tonight can watch it. And we hope that you recommend it and tell other people about this so that they can learn about Cahoots and why it's so important to the community. One thing I did find in the first time I'd had this situation where I had this wonderful person in my life who had a mental health crisis was that you're really not alone. I mean, when you talk to other people, everyone has a friend or a family member or something that has challenged them in this way. It's just that when it's happening to you, you feel very much alone. You don't know who to go to. And at this point, there's so many people that need this as a resource. So I do think that it crosses party lines, just like the jail did. I think that it is important to everybody out there, and don't feel hesitant about talking to people that you work with or that, your friends about how important this issue is, because if we're going to get this done, we're going to need everyone's support on this. We need every single person to step up and say, this is important to me. This is important because of something that's happened to me in my life. And it's important that we all get together and show that it's not just the 15 or 20 people in this coalition, but it's thousands of us here in Southern Oregon that say, hey, this is necessary and we are stepping up for this. So please take a stand. Get involved with this and make sure that you're talking to everybody about it. You're more educated tonight, thanks to this forum. Tim, I'll let you finish in terms of what you think the next steps ought to be from your perspective.
Gosh, I don't know what else I can contribute to what Sarah and Misha and Shelby have really said, other than just to really summarize, which is what I've been hearing is organize, inform, and engage. Gather in these groups, learn, and then go out and be in the community, engage with your electeds. Talk to your neighbors from a safe distance, but really, we got to get out there, pound the pavement, digitally, whatever it takes. Just organize, inform, and engage.
Thank you. If there are any other questions that have not been answered, I'll give one last chance in the chat box, or for anyone to step up and let us know what they need to know. But I thank everyone who's here tonight to listen to this, because it's an incredibly important issue in our community, something that has to be dealt with. We can't look the other way any longer. And there's so many people out there that need help. I know I hear personally about all the people talking about the Greenway and how important it is to work with the people out there and to try and find solutions for them. And that's just one little tiny tip of the iceberg, I always say, because mental health is not always apparent. Homelessness is not always apparent. It's out there in a much deeper way. So we need to make sure that we take care of each other and that we're all doing the right thing. And thank you to all of our panelists who are awesome tonight. I have learned a lot from this conversation. I hope we can continue it in some form. If anyone has ideas on what to do next, or if there's questions that you have that weren't answered, we're happy to facilitate this going forward, since we think it's so important. Anyone else? Then thank you very much. This has been awesome. And the conversation will continue. We'll leave the chat box up, as I said, for any of you to copy and paste, but I'll make sure that our recorder here puts everything in the ORD2 newsletter, which comes out on Sunday. If you don't already get the newsletter, you can go to the ORD2 Indivisible website, which is ord2indivisible.org. All of the newsletters are there on the front page. If you just scroll down to the bottom, you should be able to see them there. But you can also sign up and subscribe to it so that we can tell you what we're doing every week. Okay? All right, I see a reminder. Interest form, one more time. All right, thanks everybody. Have a lovely evening and we'll see you next month.
Thank you all for hosting.
Yeah, it was awesome.
Thanks so much, Sarah. Thanks very much.
Thank you.
Very interesting. I want to get more involved. I've been watching these emails come. It's enough. We just need a little more time.
Yeah. I'm going to jump in both feet somehow, and in between everything else I'm doing.
Good. Thank you.
I figure it'll still be around in November, really big time anyhow, right? Even if...
Yep, it's not going away.
Yeah, it's not going to go away.
Right?
What's so exciting is just watching how this has just spread like wildfire. And, talking about this a year ago is totally different than talking about it now, because now people know what Cahoots is. And I'm like, wow. And now there's national notoriety, and now Wyden's taking it up, and it's so exciting that it feels really real that we're starting to shift the way we think about public safety and about first responders. So it's a very exciting time.
Yeah,
It
that is
is.
very cool. It's good
I
to
just,
see everybody
I just
stay-
wanted to say that it sounded like Tim's really been thinking about Jackson County a lot.
Yes.
You know, like he's going to sleep thinking, what am I going to do to fix Jackson County? And he wakes up thinking that. I love it.
He
Yeah.
has connections here, family or something, I think.
Hmm.
So that helps. But I think it's now all up to all of us to just keep it going and make it stick. So once the excitement settles down, we need to just keep going. And I think that's the challenge.
And I'll be excited to hear about lobby days, you know, at different councils and the county commission, even if they're virtual lobby days. I think it'd be really super important to generate as many people as we can to pop in there and make sure that if we're not all able to speak, that we at least hold up a little sign saying this is where we stand, right?
Yeah, and along those lines, let's get a resolution put together and pass it around and get the councils to vote on it. I mean, if Phoenix is doing it, I'm a little jealous, Sarah.
Well,
Why didn't you get that one to us, man?
officially been voted on yet, but on the 17th, I think they're all going to vote for it. But so I dropped the social equity resolution in the chat here, and there were like 3 action items that I proposed. One was commit to looking into funding support for Cahoots once there's a proposal on the table. The other one was getting anti-bias training for all city staff and city councilors. And that one was tougher because people on our council started to say that bias doesn't exist. And so that was a tough conversation, right? But I do think it's going to pass. And I think if Phoenix can do it, the other city councils can too. And even though it's kind of, it's not got a lot of teeth at this point, it's like, oh yeah, we're going to look into that. It still is significant because it shows that like our city is ready. Our city wants to have this conversation. And I think that's going to make it easier for when we have the conversation about like, okay, well, maybe we should hire a consultant that maybe will chip in some money.
Absolutely. Is the coalition creating a resolution right now that can go out to all the different locales?
We could do it that way.
Let's do that. Let's do that with those 14, those points, Misha, that you showed that I'm embarrassed I haven't seen.
That's actually Karen. I can't take credit for that. It was Karen and other people, but I just happened to have it on my screen.
Well, it's gorgeous.
Credit.
And thanks, Karen, for doing that. It was an awesome list. I was looking at it this morning and was really marveling at it. So that was awesome. But yeah, I would think that if the coalition was able to create a resolution of some kind that's pretty much ready to go, and then start trotting it over and bringing it out. I mean, that's kind of a challenge to these cities and to the county to say, you know, either are you in or are you out?
And then we publicize it so they can't hide.
Yeah, and then we get people to show up to the meetings and say, hey, we want this, and specifically, we want this, and vote for this, and then do the next thing.
And it might take them a couple of meetings. Isn't that the way things go, Sarah? I mean, you're not going to, sign something the first meeting, but it would probably take a couple meetings to do it. But I do think that the pressure would just build from that point.
I think so. And a lot of the cities right now are in a place where they are looking at drafting some sort of like social equity policy. I don't know if that's already happened in Ashland. I know that was under discussion. Has it already
happened in the past?
Okay. But they could always do a second one. We have our coalition meeting is on Friday, so be happy to chat more about that in that space.
But even beyond social equity, if it's specific to the Cahoots model, I mean, saying that they were open to it and interested in supporting it, just getting a letter of support, whether it means word or money, I do think that would be a really simple first step.
Yeah.
And it would also expose, sorry, Leslie, I just want to say, and it would also expose the people running if they're not behind this. So to the voting aspect. Anyway, go ahead, Leslie.
Oh, thank you. I do have to go, but I do want to mention that I was contacted by Channel 10 news reporter who will do like any story on Cahoots. And also a radio interview, KSKQ, contacted me also, like open to stories on a regular basis. I'll be interviewed next Tuesday, and just really getting it out there to the community. Obviously, those two have contacted me, so it's like a buzz. They're wanting stories, they're ready. Anybody who wants to be interviewed, let me know. You know, Misha, if you have if you have a story, anything, just my email's in here. You can contact me somewhere in there.
You're on Real Solutions too, right? So
What's that?
you're on Real Solutions Coalition, right?
Yes.
So I can catch you there.
You can contact me through there. So that's a great venue. I mean, just that they're reaching out looking for these stories is like anyone who wants to use it and amplify any part of all of it, it's right there. So,
Yeah,
because it's a national issue right now, a national story,
yeah.
and all local news always want to be able to plug into the big national stories. They want to see, well, how is this national story affecting us here?
Exactly.
Okay.
They're ready, seriously, for almost anything I contact them for. So jump in. It's all yours. It's all everybody's resource. So
yeah, one thing that I just wanted to amplify that Misha said before, and Leslie, I know you're working on too, is that showing the need right now, showing that this is it's not a good situation, that law enforcement is responding, because sometimes these stories, they go and interview law enforcement about this, and law enforcement says, oh, yes, I know all about it. It's not practical here because blah, 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 and just kills the buzz because they're coming from this place of expertise and all of that. So I think that the focus of the stories right now, since we don't have details, et cetera, is on the need, seems to me.
the story that just came out about Tony Sancho, the OSF actor, is humongous. I just watched the Ashland PD body cam. They accelerated that to a point that was like, it made me cry. And Tony knew what was going to happen. And the fact that even Chief Ty was like, take this, Leslie, see, and then to watch it where there's our tax dollars are paying for this de-escalation training. Tony was calm. He said, yes, I will go to detox. And then the officer 3 times, I can point out exactly, escalated. And it was exactly why he ended up in county jail and why we got to see that video. That was just so heartbreaking. It started with the 911 call and the utter escalation of the APD that it's right there to watch. I mean, I'm not going to put on YouTube right now because I need to just lay low, but anyone can watch it. I can tag you. It's on my post privately. You can watch it. It's blaring, the escalation of where Tony was already complying. So
big example of why we need this process. Really, it really is.
And that story will go in the proposal because it's almost national news. Like the Oregonian, I saw it everywhere, and he's suing the county. And I even wrote a piece like, what would happen if we had Cahoots and the 911 caller called, and what would have happened with Tony? Like, I wrote it out, and wow. Yeah, so I do have to go. Any news source you want? I'm collecting tons of stories as well, Misha, so we can connect there. I have so many. And thank you all so much for this incredible evening.
Yeah, it was awesome. You guys were great.
Thank you. Bye.
Thanks.
All right.
Bye, everybody.
Bye, everybody.
Thanks. Bye.